Good afternoon, Hattiesburg. Thanks for joining us for this COVID-19 briefing for Wednesday, July 29th. We will start with test results for our health system. This includes Forest General, Merit Health Wesley, Cimarron Hattiesburg Clinic, and the Moffett Health Center at USM. Currently, 37,709 tests have been conducted since March. 4,176 have come back positive. Of course, those are not all current tests, and those are not all in just Forest and Lamar counties. 32,145 have come back negative. We have 1,377 tests which are pending as of now. In terms of hospitalizations, it was another tough day. 90 people are in the hospital right now between our two medical facilities that are COVID positive. We have additional 15 who are showing symptoms, but we are awaiting their tests to come back. That 90 is 10 over where we've been the last 2 weeks. 39 of those 90 are in the ICU. That's 4 over where we've been the last 14 days. Right now, this is kind of how hospitalizations have gone since the 1st of April. As you can see, we've been on a steady climb in terms of hospitalizations. We are down a couple from yesterday. ICU continues to stay around that 39 to 40 mark. New positive cases for today. Forest County reported 27 new cases. Lamar County reported 20, bringing the metro area total to 47. If you look at our 5-day average, this is the total since cumulatively. 1491 for Forest County. Lamar County is just over 1,000. 2502 right now in the metro area. The 5-day average is where we take the number of new positive cases and then we average it with 2 days prior, 2 days after. We've seen the metro area total come down from a couple of really big spiked days to right at 50. Forest County's right under 30. Lamar County's above 20. The problem we're seeing is these higher number of days are continuing to be consistent, and that's building up the number of active cases. Speaking of which, this is the number that we look at, the inside 14-day number, because COVID typically has a life cycle of 14 days or fewer, unless there's an adverse reaction. So what we do is we look at the number of new positive cases that have been reported back in the last 14 days, and it gives you a rough estimate, not totally accurate, but somewhat of an estimate on how many active cases you could have in your community right now. And for Forest County, that number is 386. In Lamar County, that number is 386, and I looked at that, and we're 770-ish combined. And compared to a month ago, that number was right at 205. And so we've seen a big increase, and that's problematic as that number continues to rise. Hopefully we will see that kind of crest and then come down. Statewide, we've had 1,505 new cases, 20 new deaths. Our 4 factors, this is what guides us, and the things that we try to make sure that we're doing each day that we're in this, is making sure there's widespread availability of testing. I did receive a message from someone today asking, is there any place to get free testing? C.E. Roy Community Center, Monday, Wednesday, Friday from 8 to 2. That's 300 East 5th Street. The turnaround times on those tests have shortened, which is a good sign for us. 2 to 3 days typically we can get results back at C.E. Roy. You also have Cough and Fever Clinic. You have Merit Health Wesley. You have Trust Care and some other private clinics. So the availability of testing is there. We continue to push the wearing of masks, watching our own data, which we'll talk about in a second, and then listening to all voices. And we want to talk through all of our goals and apply that local data just so you can kind of see where we are and some decisions we're having to now make. Our first goal, protecting the vulnerable. We need to do better at this because right now, again, for the second day in a row, we are over 90 in terms of hospitalizations. 39 of those are in the ICU, and in some days, we can look at that ICU number and say, hey, well, those came from so many different counties, and Forest County only was a small percentage. A third of these are from Forest County and that are in the ICU right now, and so this is hit home. This is here now. This is amongst us. The second goal for us was preventing overrun of the healthcare system, and we have to do better at this goal as well. Right now, both of our hospitals have maxed out their initial ICU capacities. That's Merit Health Wesley's 18 beds, Forest General's 48 beds. We're past that point. Both the hospitals are in their backup plan right now. And one of our hospitals has no more acute beds available. And so if there was a car accident or if you had a medical emergency, that starts to put those kind of things in flux because it's not just COVID-19 patients, it's every other patient who need health care overrunning the healthcare system. We also know there are some things ahead that we have to consider. Right now, 772 between Forest County and Lamar County tested positive in the past 14 days. Sadly, some of these folks will have adverse reactions and they will need that hospital care or an ICU bed. 1,377 tests right now are pending. We're waiting on those results. And typically what we see, especially in recent weeks, 10 to 15%, if not more, of those tests are going to come back positive. So you can add another 130 to up to 200 to that total in terms of new positives in the past 14 days, because ultimately some of those folks will get sick and require hospital care. We also know that our students are coming back in the next few weeks. Our university students are part of the lifeblood of this community. They're part of the economic impact. They're part of the great culture that we enjoy. But they will also be bringing whatever's with them and be interacting with one another as the universities open back up. So all three of these things combined lend itself to the fact that we have to consider those things, because that will ultimately affect goal number 3, which is prioritizing public health while giving the private sector the space it needs to operate creatively. No one wants to go back to a shelter-in-place environment that we saw in April. But we have to, again, the first goal will be public health. That's going to be our top priority. And so we have a limited amount of time to change course, understanding that there are all these new positive cases, understanding there's a lot of pending tests, understanding that university students are coming back, understanding that our healthcare system is maxed out. And so as a city, we're going to make the tough call with a new executive order. And in that executive order, bars, nightclubs, music venues, indoor entertainment venues will close by 10 p.m. Restaurants will cease dining-in services, whether it's indoor or outdoor seating, at 10 p.m. as well. We're going to suspend all dance hall permits, and this is all in addition to the mask requirements, the capacity requirements, all the social distancing requirements that are either from a state order or a local order. All of those things will still be in place, and those rules will need to be followed. This will take effect on Friday. Will be in effect for at least 2 weeks. We hope that that curve can bend and we can start to see some fall in those numbers, all of those numbers. Now look, I am not under the impression that COVID-19 is only transmitted after the hours of 10 p.m. I get that. However, I know that also at a certain hour of the evening, people are not going out to eat for their own sustenance. People are going out to socialize or for entertainment purposes, which Hattiesburg is a great town to do those things in under normal circumstances. Those are the reasons that we go out right now. And last weekend, most of us saw photos of people going out to music venues and being very crowded up, not having masks on. We saw long lines. We saw parking lots that were full of cars. And this was not in one area of town. It was all over the city. And the problem is that when you put people together, you're at risk. And the truth we have now is right now the risk of exposure is significant in crowds of any size. A couple weeks ago, we shared the Georgia Tech model that had been come up with to measure risk in terms of crowd size on a given county's current data. And right now in Forest County, if you're in a crowd of 100 people, there is a 99% chance that at least one person in that crowd is COVID positive. Even in a crowd of 50, there's a 93% chance. In a crowd of 25, 73% chance. Even in a crowd as few as 10, there's a 41% chance someone in that crowd has COVID. In Lamar County, the numbers are a little bit worse. In a crowd of 100, 99% chance, 50, 96%, 25, 79%. Even in a crowd of 10, you almost have to have a 50% chance that someone in that crowd is COVID positive. So understand that you are at risk in crowds of any size, even if you're among friends and extended family. We've heard some really heartbreaking stories about friends going out and somebody getting it and having a really bad reaction, or an extended family at a family gathering. And so those are things we have to take into account. We have a limited amount of time to change course, and I can't drive this point home. I'm not trying to scare you. We just have to make some good decisions, because if you were in a car accident tonight, or if somebody you know had a medical emergency, we want the healthcare to be there to take care of those folks. Understanding that all of these new things are coming forward, we have a limited amount of time to change course. I believe, and we said this, COVID's going to be with us until there's a vaccine or a reliable therapeutic. And we know that we can't keep the city shut down for a year or more. I think a functional normal is possible, that we can carry on and do some things to mitigate risk by wearing masks and doing some other things. But we really need to make some good decisions over the next 2+ weeks. We need to make good collective decisions. That's why the city is setting this policy. We need our businesses to enforce things, whether it's the mask policy or really watching their capacity limits, knowing that we can't patrol every person and every business at one time, doing the right thing because it's the right thing to do and we want to keep things open. But we also need you to make good decisions in terms of where you go, who you interact with, and whether you wear a mask or not. Our act of courage after all of that goes to JA. They did a t-shirt art design contest calling Doing Good Together. It was there to challenge people to do the right thing, better their world, and I want to congratulate Miss Gabby Cox. She's a freshman at Hattiesburg High School. She won that competition. There will be t-shirts for sale with her artwork on it, and so congratulations, Gabby. Thank you, JA. As we go into the rest of this week, please remember to wash your hands. Take care of yourself physically and mentally. Wear a mask if you go out in public. Do only what is essential. And remember, especially right now, you're safer at home. We will get through this together. It just involves us making some good decisions over the next couple of weeks to really try and stem that tide. Thank you.